Okay, so again, I'm Michael Levine Clark from the University of Denver Libraries, and it's appropriate that I'm on a panel today with David and Judy because really from two different conversations with them is the reason why we joined this pilot. I had been talking to Judy over a while because based on the project she's been working on with Science Direct, and she's going to talk about that a little bit, I think. And then I gave a presentation on really the same topic of managing publicly funded research at the Council of Science Editors with David, and mentioned that I really wanted a way of automating this process. And he said, well, there just happens to be this pilot with Chorus, and before we knew it, we were joining that. So I think it's important. I usually don't do the about my university in presentations, but I actually think in this particular case it matters quite a bit. We are a private institution. We're an R2. We are not a research-heavy institution. And our profile is interesting. We're about half undergraduate and half graduate. So we have about 11,000 students, and half of those are graduate and half, almost exactly half, are graduate and undergraduate. And most of our graduate programs are professional, right? So education, social work. We have a lot of psychology programs, several different. We have, and most of our non-professional programs are clustered in the social sciences, actually. So it's an interesting profile. I think it's not typical in terms of a science-heavy institution, for sure. We have about 700 full-time faculty, and we only have about 500 articles indexed in Web of Science annually, right? So we're not producing a lot of research at this institution, yet we have the same problems as larger institutions in trying to manage that and trying to cope with the requirements of helping our faculty with compliance. So we've got two challenges as I see them, and these are big challenges that make it very difficult to help our faculty and our students with meeting the requirements of their funders. So faculty are confused. Faculty have, as David already mentioned, they have multiple mandates from multiple different places, right? There are lots of different funders, sometimes multiple funders funding the same project. There are cases where they're working with somebody from another institution, and that institution is requiring something. There is sometimes they've got a government entity, and sometimes it's a private entity, and then sometimes they're working across multiple institutions. Trying to manage that is really difficult, and then even understanding what the right version is of an article. What can you deposit the final version? Is it a preprint, and so on? Is really difficult. Faculty do not understand that often, and they don't want to have to understand that. Makes it very difficult as a librarian to help manage the institutional repository. So trying to help faculty by providing the institutional repository as a place where they can deposit articles is not an easy process. We have to do this one-on-one with faculty. It's a negotiated process. It's not high priority for them, and yet we're trying to help them, and we're also trying to use the institutional repository to promote the institution. Again, the faculty are often confused about what version they can share. I've felt for a long time that this has to be an automated process. It doesn't work even in an institution of our size, to do this one-off. It's a lot of staff time, and it's even if you invest a lot of staff time, you often don't get to the right answer because it's sort of lost in the process, right? So we were really interested in participating in this pilot with Chorus, where we could help build a dashboard and a process for libraries to help our researchers with compliance. Here's a snapshot of the dashboard for the University of Denver. It shows key performance indicators, and it shows history sort of over time, right? So this is December of 2016 up until May of 2017 on this slide. And you can see how the numbers have moved over time, so that as of today, we only have 72 articles represented in here. 68 of them are archived. We have 8 publicly accessible on publisher websites at the bottom, and 15 where we have an indication of the reuse terms for that article. So that's sort of the overall snapshot of what it looks like. From here, you can drill down and you can get to the individual articles, and then you can start to really do some great analysis there. Here's a different snapshot of these same numbers. So we can see here that 8 of the articles, same number from the previous slide, obviously, just a different view, but 8 of them are publicly accessible on the publisher site. The next one is the reuse terms, and the next one is whether it's archived or not. But we did some analysis on our own, and this is where being a small institution with not a lot of articles helps us, right? Because we were able to go in, and we only had 72 articles here. So we were able to go in and we were able to do a lot of work checking on the overall presence of those articles anywhere on the web, to try to understand whether maybe it was deposited somewhere, trying to figure out a little bit more information about these. So we checked all of these. Interestingly, we found that here there were, so these are the ones we checked, 63 of them. Chorus had already checked actually 8. But we found that there were 4 that were verified by Chorus. We found 5 errors, which is interesting. And among those 5 errors, one was actually an article from another institution. We couldn't find any indication of a connection to the University of Denver. And then the 4 were articles that were not actually openly available, even though we were seeing them as that in the system. And that was helpful information, I think, as we were developing this. This was just last week that we did this. It's already been fixed within Chorus. And hopefully this process of identifying these errors will help make the system work better overall. Here's a little bit more information. You can see breakdown by agencies. We only have funding from 6 different agencies at the University of Denver. Most of that funding is coming from 3, NIH, NSF, and U.S. Department of Health and Human Services. But we were able to go in and do some more work. So this is us searching for each and every one of these and trying to understand what's the overall disposition of these articles across the web. What have these authors done aside from making it available on the publisher site? Where have they put this? How have they tried to make it open? We're finding that we're 27% non-compliant. These are articles that should be available openly somewhere, and 27% are not. 62% are openly accessible. 17 of these are accessible in multiple places. And you can see here what that breakdown is. We looked at how they were spread out by funding agency. And this, I'm not going to go into detail on this because I don't think it's relevant now, but as you start to understand what the requirements are for each of these funders, you can say, well, they're making them available in a way that actually doesn't follow the rules, right? So if you see that things are in an institutional repository but really shouldn't be, or you can see that they're all on a publisher site but they're supposed to be green, that might be a problem. So we have the funding agencies here. You can see that these numbers are kind of irrelevant in terms of some of these. We only have one article from the CDC, but it's in 3 different places. Which is interesting, I think, right? So that author has tried to make it available in a number of different places. And then, so a few conclusions. We had poor compliance at our institution. It was good to know that, right? It's helpful to know that. It means that it makes it easier to go back to faculty and say, you really need to take this seriously. It helped open up a conversation with our Office of Research about how we can work together better in this process. And again, it helped us identify articles that should be open, articles that we should be doing something more with. And it helped us improve some manual processes on our end as well, right? So in the process of doing this checking, in the process of really getting an understanding of how our faculty were doing at compliance, we helped improve some systems on our end. What's interesting is the initial reason that I wanted to do this was to help automate the process for the institutional repository. We didn't do that, but we're still interested in doing that, and I think that this is still a tool that can help us do that. So in final conclusion, it was useful for us, and even useful for us as a small, not research-heavy institution. So I'm going to now turn it over to Judy to give her perspective from a larger institution.
Thank you, Michael.